The Health Secretary has apologised to patients in NHS Grampian as the Health Board struggles to cope with increasing demand. Neil Gray says the Scottish Government is committed to supporting the board after a record spending high of almost £70 million over budget. It comes after a critical incident at Aberdeen Royal Infirmary in November, which saw ambulances diverted to other hospitals. Gray MSP reports.
Mounting pressures have been growing within the NHS across the country in recent months. At Aberdeen Royal Infirmary, financial concerns are just the latest strain. In November, a critical incident was declared at the hospital, which saw patients forced to travel to Inverness and Dundee for care. Today, the Health Secretary apologised to both staff and patients.
Where there has been a situation that people are waiting for too long or they're having to travel too far in order to access care because of the clogged system that we have seen in too many parts of Scotland, then obviously I apologise to patients and staff for that matter who are having to deal with that.
But those in opposition warn another critical incident could be declared in the coming months if immediate action isn't taken. They say the Health Secretary has failed in his role.
I think this is an appalling situation for people, relatives, friends, family and the patients to find themselves in. And Neil Gray's latest apology, the latest apology from an SNP that's had charge of this for 18 years, to offer just yet another apology is simply not good enough.
Neil Gray met with NHS Grampian today after the Health Board revealed it's expected to record its highest ever yearly overspend. It's predicted there'll be almost £70 million over budget. The Scottish Government says they're committed to working to help the financial situation.
I think what's most appropriate is obviously to hear directly from staff, as I was able to do today as I was in the Aberdeen Royal Infirmary, and to be able to work with the management to ensure that the diversion of resources into the right areas has been done properly, that the improvement plan is robust, and that's what I'll be discussing with the Chair and the Chief Executive today.
As severe financial pressures and ongoing issues with capacity continues, the Scottish Government says they'll monitor the situation to ensure there's not another critical incident and support NHS Grampian as much as possible.
Well, Gráinne joins us now from ARI. Gráinne, what happens next?
Well, Sharon, as we've heard, the Scottish Government are working very closely with the Health Board here about the challenges that they're facing. Now, the board has previously highlighted that because of its financial situations, it doesn't have the means to get more beds, which could prevent another critical incident from taking place. So on the one hand, they're dealing with these cost-saving measures, but on the other, they'll be doing everything they can to prevent an escalation again.
Gráinne, thank you.